Good afternoon, Rashmi. Can you hear me? Am I audible?
Yes, sir.
Am I audible?
Yes, sir.
Okay, okay. Okay, without
Okay.
wasting any further time, because rest will join on their time and they can follow the recording also. One change you will see that I have this headphone have been gifted by one of our learners to improve the sound quality. I hope the sound quality is better today. Is it not? It is noise condenser so that you can hear me clearly. Can you hear me?
Yes, sir.
Okay. Anirban,
Yes,
can you hear
sir.
me?
Yes,
একটু
sir.
জোরে বলো. Okay. Okay. Uh,
Yes, sir.
I I hope I can hear you also. Okay. There should be a good output and input audio quality. I hope there is no noise today as it's better condenser is there. So let us start today's class with the introduction. Okay, have we divided the introduction in three sections, and then the first section was divided in further chapters. Last class this have been discussed. Is it not?
Yes, sir.
Okay. জাস্ট কনফার্ম মিন্স একটু তাড়াতাড়ি বলে দিলে আমরা বেশিক্ষণ ওয়েট করব না, টাইম ওয়েস্ট হবে না। ওকে, थोड़ा सा quick response. I need quick response with you people so that the time in waiting should can be preserved for dealing with the subject. The chat box is in front of me. You can use the chat box also. Okay. Now go directly to the introduction. I hope you have went through that Boric's sixth edition preface and the this James Cross introduction to the Boric's translation. I hope you have gone through that. So we will directly start our discussion from this introduction chapter, which is written by Hanneman. Introduction was there from the first edition onward, and this form of introduction which we have now with us is review of therapeutics have been introduced from the fourth edition and onwards. What was there in the introduction from first to third edition? There was some cure with homeopathy in the old school literature. Okay, so this is a misconception that introduction has been introduced in the fourth edition. Introduction was there from the beginning. Okay, so you will be seeing the first paragraph, a bit lengthy paragraph, and almost a single sentence is there in this first paragraph. You will try to find out where is the full stop, and at the end you will getting the full stop. This is the theme of Organon, as we are again and again telling that Organon should be made easy to read. So we will point out these things so that it can be easier for us to read also. First we have to read, then we can only understand, and then we can apply. So this is the mode of Organon, that when it is out of passion, Hanneman uses too many sentences. Okay, we will extract our means whichever is for our work, we will extract that word or phrase. Okay, not whole paragraph is necessary. Okay, in Organon of Medicine, you will get lengthy phrases, lengthy paragraph, often a complex sentence. That is one of the limitations for our reading of Organon. Okay, per se you will get tired of that. But what is there? You will lose your chain of thinking that what is written here. So first paragraph. The gist is that this paragraph is dealing with the medical anthropology. Do you know what is anthropology? Anthropology? Anyone? Yes or no? If yes, what it is? A quick response will lead us to further discuss the subject. Okay, you can chat it also. You can give your answer in the chat box. You can type, or you can say directly. Have you ever heard the term anthropology? What is anthropology? What is anthropology? So anthropology is the study of human existence on the earth, study of human beings. Their how how human beings have been living on earth, what are their cultures, what are their social norms since the very beginning of their existence on the earth. Okay, so there is one subject, uh, means there is one sub-subject of this anthropology, and it is medical anthropology. Medical anthropology means how people used to treat themselves from the very beginning. Okay, so right in the margin of this paragraph, tracing back the medical anthropology, tracing back the medical anthropology. Okay, you will get the description of disease in the older text also, and you will be surprised to find that this what Hippocrates have described the migraine about, the modern textbook is describing the same symptoms of migraine. What the Hippocrates is telling about the tuberculosis, the symptoms of tuberculosis, the modern textbook is telling the same symptoms of tuberculosis. The difference is only the pathological understanding. Only the pathological understanding differs from the older. So what is medical? That is a different topic. Going into that topic will lead us to somewhere else. Okay. So we are not going into that topic. How medical anthropology is means have been traced back in this paragraph. This is our topic of discussion only. So read this paragraph. How older people used to treat themselves. This is called medical anthropology, and we can give heading to this paragraph as tracing back the medical anthropology. You can write in the margins, tracing back the medical anthropology. There are some things which is coming in my mind to discuss. I will not discuss. We will get some time to discuss those things. Okay, when we will read aphorism number, I think it's aphorism number 6, footnote, and there is a sub footnote. We will discuss that. Okay, tell me if I am going a bit fast. I will make myself slow. Okay, sometime out of passion, I utter things fast, very fast, so that you cannot grasp this. If I'm a bit fast, tell me. I will repeat it again, and I make myself a bit slow. Now read the first paragraph. Read the first paragraph. From
As
as
long
long men have
as
existed, they have been liable from the very beginning.
as long
We have
as
discussed, I
long
think
as
we have discussed the review of therapeutics, allopathic palliative treatment that have hitherto been practiced in the old school of medicine. This subject, this topic we have discussed what this means. Okay, now directly to the first paragraph of our introduction, and this is tracing back the medical anthropology. So someone volunteer yourself so that we can read and then understand.
sir,
Read it. Please
okay.
volunteer yourself to
As
read.
long as sir, sir, am I audible? Sir,
Okay. Should I call the name and you will read? So I can see Rashmi. Can you read please for us?
Yes, sir. As long as men have existed, they have been liable, individually or collectively, to diseases from physical or moral causes. In a rude state of nature, but few remedial agents were required, as the simple mode of living admitted of but few diseases. With the civilization of mankind in this state, on the contrary, the occasions of diseases and the necessity for medical aid increased in equal proportion. But ever since
Okay,
that
stop
time,
here.
soon after,
Stop here. Stop here. Underline this,
yes,
individual or collective. As long as men have been existed, they have been liable individually or collectively. What is collectively? That is epidemic. That is epidemic to diseases from physical or moral causes. Now I want you to open this aphorism number. I think it's 31. Aphorism number 31. Okay, the first line, inimical forces Partly psychical, partly physical. Underline this. Partly psychical, partly physical. The causes of disease, the inimical forces to our bodily existence are partly psychical. Okay, some anger, some grief, some sorrow have depressed and causes excitation of disease. This is one of the moral cause or one of the psychical cause. Then partly physical causes. Physical causes are getting wet in rain. Okay, these are some. There are some physical causes, and there are some moral causes or psychical causes. So underline this by physical or moral causes. In root state of nature, few remedial agents were needed. Previously, the organisms were simpler. The human beings were simpler. Okay, so simple diseases were there and simple cure were there. But as the anthropological history of man progresses, the diseases becoming more complex. Every now and then you are seeing more complex diseases are coming out. This form of cancers were not there in 50 years before. This form of AIDS or HIV sort of diseases were not there. This sort of autoimmune diseases were not there. Okay, this sort of fungal infections were not there before, but they are increasing now. Every now and then diseases are becoming more complex. Why it is happening? Because of irrational mode of living, number one. Number two, too much vaccination. I am telling this too much vaccination thing from Vitholkas philosophy. Okay, Vitholkas in his philosophy discusses the science of homeopathy. The science of homeopathy, that is not the part of our subject, part of our discussion. Vitholkas philosophy is a bit advanced level study. Now he discusses that why the organism has been rendered more complex and diseases are more complex now because of too much use of vaccination, too much use of antibiotics, too much use of this too much irrational mode of living. These are the things which are letting the organism more complex nowadays. Okay, all of means every now and then you will get cases in your clinic, acute diseases not responding to your treatment. Acute diseases with fever, giving indications for brainia, giving indications for rust, and still it is not being treated. Or every now and then you will get such cases which is not responding to your treatment. What do you think? Why this is happening? Homeopathy is not working. No, homeopathy is working, but there are some obstacles to cure. And these you will get in deflected current of Roberts. What are those? Okay, because the organisms have been rendered complex and diseases are now complex, so your indicated medicine, and more often these are the cases for the newcomers, means those who are coming to you first time, those whom you are treating. Understand this thing clearly. Those whom you are treating for so long, if they suffer from acute diseases, they will respond with your acute medicine. But those patients who are coming to you firstly, before that you have not seen and you have not got chance to remove those obstacles of vaccination, obstacles of too much antibiotics, those patients will not respond to your acute treatment. So one thing I'm going to tell that should remain in this class only, should not be uttered in your viva table or your examination or before your Organon teacher. This is that for practical purpose, because our discussions are for practical purpose only. So I have seen some practitioners who are prescribing for those acute coming to them first time. I have seen those practitioners to take slight family history, to take slight this past history and prescribe some sulfur 31st dose or thuja 31st dose or that syphilinum 30 or 200 first dose in all fraction depending upon the merit of the case. They are prescribing for these acute cases and so that their acute remedies can work. Okay, this is one of the method I have learned from some practitioner using in here in Calcutta, that before they prescribe for acute diseases, they will prescribe after taking some miasmatic analysis of the patient, they will prescribe some miasmatic diseases, and more often these are either sulfur or thuja 30. Patients coming to them for the first time, they will prescribe thuja or sulfur because the organism has been rendered so complex. Okay, so this is not the case often with the patient who you are treating. Clear? Whom you are treating previously. But those patients who are coming to you first time and of have been vaccinated so often that this vaccination is causing a hindrance for your medicine. Okay, you will get reference for this. Write the references also, because we are not telling anything without any reference. You can write the reference for the vaccinosis of Burnett. Vaccinosis of Burnett. Okay, we our mode of discussion is reading, understanding, and applying. Okay, so we will not comment anything outside of available literature. Okay, available literature we will get reference, and you will write reference and try to follow it in your leisure time. So follow the vaccinosis of Burnett. You will get this book in market and try and read that. So, and Science of Homeopathy by Vitolkas. Read the chapter where the Vitolkas is discussing about why the organisms are rendered more complex and why the diseases are more complex and why in acute these our indicated medicines are not working. So this is one thing. And Hahnemann is telling about his time that organisms are becoming more complex. So diseases are becoming more complex. Next. Next, please. Please go on.
But ever since that time, soon after Hippocrates, therefore for 2500 years, men have occupied themselves with the treatment of the ever-increasing multiplicity of diseases, who led astray by their vanity, sought by reasoning and guessing to excogitate the mode of furnishing this aid. Innumerable and dissimilar ideas respecting the nature of diseases and their remedies sprang from so many dissimilar brains, and
A
the
bit,
theoretical
please
views.
read it a bit slowly. A bit slowly.
Okay, sir. Innumerable and dissimilar ideas respecting the nature of diseases and their remedies sprang from so many dissimilar brains, and the theoretical views this gave rise to the so-called systems, each of which was at variance with the rest and self-contradictory. Each of
Now
these.
underline this sentence. This sentence you are getting innumerable disease from innumerable disease to self-contradictory. Underline this. This is actually tracing back the medical anthropology. Okay, thinking that this disease should be due to that. Instead of getting symptoms, they are curing. What is the mode of treatment in homeopathy? We get symptoms and try to match our disease with the symptoms. So that is another part, another topic. We will discuss it later. But what the physicians from the very beginning were trying to do, they were trying to discover the cause of disease and attack that cause so that this can be remedied or this can be treated. Okay, so they thought that there are something wrong with the blood. Okay, tracing back the medical anthropology, they thought there are something wrong in the blood and they advised bloodletting. They thought there are something wrong in the brain and they advised craniotomy. They advised cetons. They advised lots of their treatment which were abundant with the advancement in pathology. Okay, so their mode of treatment was directed and hypothetical, means they were giving out their ideas. So this can be treated by this, this can be treated by this. Still, these are the things. Most modern example you can see in the treatment of COVID-19 by modern physicians. What they were telling from the very beginning, that this is the ultimate cure for the COVID-19. Now every now and then new medicines come in discussion that azithromycin is this antiviral. Okay, so it can be used. Later on it was found that no, it is not antiviral, it is antiviral only when it is used with chloroquine. Out Later on it was found that no, it is also not helpful. So these are the ideas we are, means human beings were formulating out of their own without searching for a concrete principles, and these were the ideas which Hahnemann called kaleidoscopic view. Kaleidoscopic view. Can you give the reference for this? Kaleidoscopic view. Aphorism number 25, footnote. Aphorism number 25, footnote. Kaleidoscope. What is kaleidoscope? It is a plaything, playing toy of an child, where you can see every now and then with the reflection, the image changes. Reflective image changes there. So this is kaleidoscopic, and we need not to fall in the trap of that. Okay. So next.
Each of
Next
these
sentence.
subtle Each of these subtle expositions at first threw the readers into stupefied amazement at the incomprehensible wisdom contained in it, and attracted to the system monger a number of followers who re-echoed his unnatural sophistry, to none of whom, however, was it of the slightest use in enabling them to cure better, until a new system, often diametrically opposed to the first, thrust that aside and in its turn gained a short-lived renown. None of them,
Okay.
however, was
Underline this system monger. Underline this system monger. And found down the line theoretical waves. Theoretical waves. The modern example we have discussed about COVID-19. This was happening for the treatment of COVID-19. Okay. Next.
None of them, however, was in consonance with nature and experience. They were mere theoretical waves, woven by cunning intellects out of pretended consequences, which could not be made use of in practice, in the treatment at the sick bed, on account of their excessive subtlety and repugnance to nature, and only served for empty disputations.
Underline theoretical wave. Underline system monger. Okay. Now please open aphorism number 6. Go on to footnote. Footnote second para. Footnote second para. Sixth line. Sixth line. Prima causa morbi. Have you got that? Have you got
Yes,
that?
sir. Yes, sir.
Okay. Now read it. Now read it.
As a prima causa morbi, whilst they reject as an object of cure and contemptuously despise the sensible and manifest representation of the disease, the symptoms that so plainly address
Underline.
themselves to
Underline this.
us.
Underline this. Sensible, manifest representation of disease. The symptoms. They search for prima causa morbi and contemptuously reject the sensible manifest representation of disease, the symptoms. Underline this. Now you will get here a sub footnote. Sub footnote. Read that also.
The physician whose researches are directed towards the hidden relations in the interior of the organism may daily err, but the homeopathist who grasps with requisite carefulness the whole group of symptoms possesses a sure guide, and if he succeed in removing the whole group of symptoms, he has likewise most assuredly destroyed the internal hidden cause of the disease.
Okay. The physician, now underline this. The homeopathist who grasps with requisite carefulness the whole group of symptoms possesses a sure guide. Underline this. Now let me give you an example from this medical anthropology. If you are searching for the cause of migraine, okay, they will tell that these things means till now there is no cause have been discovered for migraine. It is means etiological nullity means it is the diagnosis of exclusion. Migraine is the diagnosis of exclusion. Okay, if there is no cause detected for a headache, they will call it migraine. Clear? Now, for a simple headache, if you are searching for cause, temporal artery, there is a aneurysm of temporal artery, there is a aneurysm of this and that artery, there is this and that thing in the brain, and trying to attack that part. Okay, giving your medicine to that part. Later on, after 20 years or 30 years, it has been found that no, it was not due to that causation. Now what you will do, you have to change. You were mistaken in your treatment because of your not understanding the pathology. You were mistaken in your treatment and have harmed your patient. But if you were grasping the symptoms and giving the medicine on the basis of the symptoms, you will see that the Hippocratic description of migraine matches the modern textbook of medicine's description of miasm. Okay, the Hippocratic description of the tuberculosis matches the modern textbook description symptoms of tuberculosis. Clear? So the homeopathist, what is the line? The homeopathist who grasp the symptoms for their cure will never fail. Okay, so you should respect the symptoms of vitality. That is why this is the external manifestation of disease and should be taken care of. Okay, nothing else. That is what is written in aphorism number 6. Please open aphorism number 6, 1, 2, 3, fourth line. Fourth line, you will find except changes in the health of the body and mind which can be perceived externally by means of the senses. Nothing else. Okay? Underline this. Except changes in the health of body and of the mind, which can be perceived externally by means of senses. These are the things you should take care of. Nothing else, because and one thing you can object that during the time of Hahnemann, this pathology was not that advanced, and so that he was right in telling that you should not consider pathology to prescribe upon. Yes, you to some extent you are correct. In some cases, we prescribe on the basis of pathology also. Okay, when you are not getting symptoms, you can get. There are two things, nomina and phenomena. We will get to that later on in our discussion. What is this morbid phenomena? Aphorism number 6. You will get a term morbid phenomena. Got it? Got the term in the bracket? Got that term in the bracket? Got that?
Yes, sir.
Okay, that morbid phenomena. What is this morbid phenomena? Is the external symptoms the nomina is giving out. By seeing that symptom, you can reach to that nomina. Nomina is the pathology. Okay, but that is not necessarily present all the time. So it is a futile attempt to try and search the pathology always. Okay, there are some diseases which you will find on investigation and there were no symptoms. Okay, in Bengali we will say কাগজে রোগ আছে কিন্তু শরীরে means কষ্ট নেই, কাগজে রোগ আছে কষ্ট নেই। কখনো কখনো এরকম হয় কষ্ট আছে রোগ নেই। Okay, symptoms are there but there are no pathology detected. Okay, patient will come to you with lot of investigating reports and they will tell that I have visited urologist, I have visited diabetologist, endocrinologist, and they played a refer game to me and there was nothing. So in that case, you have a superior hand. Even before knowing that COVID-19 has been caused by a virus, you can treat your patient depending upon the symptom. Is it not a superior hand you are having over modern school of treatment? They need a diagnosis for them to start treatment, but you need not a diagnosis because you are respecting the symptoms. Okay, so patient will come to you with lots of investigation and there is no nomina detected. Still you have got the phenomena, the morbid phenomena, the symptoms you are getting, you can prescribe upon that. Okay, the phenomena and the nomina, and reference for this is the Knowledge of Physician by Richard Hughes, this book. Knowledge of Physician, this is in our syllabus. We will go through that some portion of this book during course of our time. So nomina and phenomena, it is this symptoms is morbid phenomena and not necessarily always have a corresponding nomina, but during our advanced pathological understanding most often we get, and if you can match this nomina and phenomena you can be confident of your medicine to be work. If you are getting a stitching pain in the chest, aggravated by inspiration, aggravated by movement, what is the medicine? What is the medicine? Stitching pain in the chest aggravated by motion. What are the medicines
Bryonia,
coming to your mind?
Bryonia, sir.
Bryonia. Okay, there are lots of medicine, but Bryonia leads them all. Now, if you are sure that this is due to an attack of pneumonia in past history of the patient, okay, and we know that Bryonia can produce this pneumonia, okay, Bryonia in its toxicological effect can produce this pneumonia. So you will be confirmed of your medicine. Still, you can prescribe on this modality, you can prescribe on this totality of other symptoms matching with the Bryonia, you can prescribe. But if you can understand that this is due to a pneumonia, a pleuritis, patient have suffered in the past, so you can be sure of your medicine. Okay, you can be sure of your medicine. Now patient have been attacked with the caries in the spine. Caries in the spine. What is called? It is called Pott's disease, or tuberculosis of the spine. And more often the vitality is so low that you will not get some symptoms. But if you know that this is the caries of the spine and your Drosera can produce this tubercular state, this tuberculosis of the spine. So you can prescribe your Drosera depending upon the nomina. Now you know that there is the pathology in the spine, but there are no symptoms. Here we are prescribing on the pathology because the vitality is so low that it is not giving the symptoms. In that case, due to advancement of pathological investigation, due to advancement of our pathological understanding, we are taking this pathology into consideration and thinking of prescribing Drosera. By the way, for telling this Drosera, a tubercular drug, I am referring to Emil Tyler's drug picture. Okay, read Emil Tyler drug picture, Drosera, you will get that. Drosera can produce tuberculosis. Okay, and if you can get symptoms of Drosera in your patient and there is a nomina you are getting, pathology you are getting, you can be sure of your medicine. But again, I am telling that there is no need of pathology if you are getting your symptoms clearly. Okay, still you can prescribe your medicine, but if you know this is due to that pathology, then you can be of double sure. Why it is so that so and so physician prescribing Bryonia taking 500 rupees as consultation and you are prescribing Bryonia taking 100 rupees. Why? So and so physician prescribing Bryonia 4 doses and charging 1500 rupees as consultation and you are charging only 100 or 50 rupees. Why it is that? Because of that confidence only, and that confidence will come from this study, from seeing with an eye that this symptoms may be coming from that pathology, and if I prescribe these symptoms, it's bound to work. Okay, from that confidence they are getting from their understanding of this phenomena, from their understanding of this phenomena, from their understanding of the depth of a medicine. Okay, so in this case, what we have discussed, it is the understanding of pathology and how far it is necessary for our prescription. Clear? Anything you have not got or lost somewhere, we will discuss it again. So this was the case. Next, read next paragraph. Please read next paragraph.
Simultaneously, but quite independent of all these theories, there sprung up a mode of treatment with mixtures of unknown medicinal substances for forms of disease arbitrarily set up and directed towards some material object completely at variance with nature and
Underline this,
experience.
underline this, underline this. These were the system mongers that I will treat by bloodletting, I will treat by hunger diets, I will treat by this medicine, I will treat by that medicine. System mongers were there, and then one system we are dealing, first three chapter we have told of introduction is dealing with the tole causum, remove the cause. So it was directed to the cause of the disease, to the pathology and removing them. So this is the tole causum, means remove the cause. Okay, and this is one of the philosophy of old school, that if you remove this cause, the disease will cease to exist. Okay, and we do not follow this pathology. We do not follow this sort of thing, tole causum. Okay, if you are removing the cause, the disease will remove. It is not. Okay, you are thinking that you will remove the gallstone and you have cured the disease. It is not. You are thinking you have removed a lipoma and this is the cause of disease. A lipoma, you are telling lipoma is the cause of disease and removing it. So where were the disease? If lipoma is the cause, understand what I am telling. If lipoma was the cause of disease, okay, where were the effect? What was the effect? The disease and the cause cannot be same at the same time. Okay, there are series of cause and effect which should be taken care of, and we are telling that disease is dynamic in nature and traveling in the body, settling us at one point of time at one organ, and removing that organ or that pathology will not going to cure that disease. Chronic disease can only be cured by homeopathic treatment only. Remove lipoma, you will suffer from other disease. Remove that, you will suffer from other disease. Remove that, you will suffer from other disease. Because we believe the disease is of dynamic character, it will travel on to the next organ, to next organ, to next organ, ultimately death. This is the nature of chronic disease until and unless it is treated with homeopathic medicine. This is the second paragraph. Third paragraph, what we have, third paragraph is dealing what we have told, that with respect to pathology, with respect to anatomy, we all know these are necessary. That is why we are studying them. Pathology is necessary, surgery is necessary, gynecology is necessary. We should not mock these things. But you cannot be a researcher and the physician at the same time. You cannot be an anatomist and a physician at the same time. Okay. Be one, jack of all trades, master of none. Okay. Read those things, read those auxiliary things to utilize it in your clinic to be a good physician. Okay. So this is all about para number 3. Read it. We have discussed it before also. Read it.
Without disparaging the services which many physicians have rendered to the sciences auxiliary to medicine, to natural philosophy and chemistry, to natural history in its various branches, and to that of a man in particular, to anthropology, physiology and anatomy, etc., I shall occupy myself here with the practical part of medicine only. With the healing art
Only
itself
underline this,
in
underline this. I shall occupy myself with the practical part of medicine only. Next.
with the healing art itself in order to show how it is that diseases have hitherto been so imperfectly treated. Far beneath my notice is that mechanical routine of treating precious human life according to the prescription manuals, the continual publication of which shows, alas, how frequently they are still used. I pass it by unnoticed as a despicable practice of the lowest class of ordinary practitioners. I speak merely of the medical art as hitherto practiced, which, pluming itself on its antiquity, imagines itself to possess a scientific character.
Okay, wait here. So, what is prescription manuals? Previously, there were authorities who will give. First, you have to diagnose a disease. This is the disease, and this is the treatment. So, they gave this prescriptions mixture, a sort of mixture, that if you have diagnosed this disease, that it is a retinoblastoma, then you have to give this medicine. Okay. So previously it was practiced. Now means I have seen this usefulness of this medicine or this sort of mixture in that case. Now this has been practiced in old school, means Ayurvedic and Unani medicines. Okay, those mixtures. You go to any allopathic, any Ayurvedic or Unani shop, and you will get a Majun type of mixture, and you will see that it has been made according to that prescription. If you open that book in your Google, you will see that that is 300 or 400 years old or 500 years old prescription manual, and this medicine have been made according to that manual. Okay, so this was this is an outdated thing for us. Prescription manual, diagnose a disease and find out a prescription, and unqualified practitioners were also using those prescriptions manual available in the market. Nowadays these has been practiced in Ayurvedic and Unani medicine. Next.
Fourth para, sir.
Yes, fourth para.
The partitions of the old school of medicine flattered themselves that they could justly claim for it alone the title of rational medicine, because they alone sought for and strove to remove the cause of disease and followed the method employed by nature in diseases.
Okay, this is why Hahnemann dropped the term this rational from his organon of medicine. Okay, everyone was rational at that time. That I am rational, I am rational. So Hahnemann thought that I will be lost in these rationals. Okay, so have dropped the term rational from his title, organon of medicine, from title of the organon of medicine. Next. Fifth.
Tolle causam, they cried incessantly, but they went no further than this empty exclamation. They only fancied that they could discover the cause of disease. They did not discover it, however, as it is not perceptible and not discoverable. For as far as For as far the greatest number of diseases are of dynamic spiritual origin and dynamic spiritual nature, their cause is therefore not perceptible to the senses. So they exerted
Underline
themselves
this.
to imagine
Underline this.
one.
Underline this. Sorry, we got disconnected due to some technical error. Am I audible to you? Okay. Uh, we got disconnected due to some technical error. Sorry. Am I audible to you?
Yes,
I
sir.
hope I. Okay. Okay. Thank you, Anirban. Now, I have asked you to underline this. Greatest number of diseases are dynamic, spiritual origin, greatest number. So Hahnemann was so particular about his about his words that he knew that there are some diseases which are falling under manuals of surgery. Okay, he knows that there are some diseases due to mechanical causes. Open aphorism number 13. Aphorism number 13. Now read it. The first line. The first line in the bracket. Read it. The line in the bracket.
That does not come within the province of manual surgery.
Underline this. Now think of some surgical diseases. Tell me about some surgical diseases. Think and tell me about some surgical diseases. Please be quick. We are running out of time.
Appendix,
We want to finish.
appendix,
Appendicitis.
appendicitis.
Okay. Next, Anirban, what you are telling?
Umbil- that day we saw
Huh?
umbilical hernia. Umbilical
Umbilical hernia. Okay. Anyone? Add further. Quick, quick. Add more.
Hydrocele.
Hydrocele. Okay. Add more. Add more.
Teratoma. Sorry, sir. Sorry, sir.
Yes.
Sorry.
Yes. We are getting here. Okay. Acha, in your those who are of UG examination, going for their UG examination, should not utter those terms which means irritate your examiner. Okay, so go with the step by step, simple. Always passing the organon exam is very simple. Don't irritate your organon examiner. Okay, they are orthodox teachers. I am also a organon teacher, and with respect to the profession and respect to organon teachers, I am telling just the mindset. Okay, maybe I will behave like this only when I am on the Viva table. Okay, so anyone add on? Add on, please add on. Surgical diseases.
Bony exostosis.
Huh?
Bony exostosis.
Oh, bony exhaustion. Very good. चलो हो गया. We will open now Robert's classification of disease. Robert's classification of disease, page number 181. Sixth para. Anyone got that? Robert's classification? Anyone got that? Robert's classification, disease classification.
The sixth para.
Sixth para.
As severe that one.
That is fifth para. Okay, read that. Read that. Hahnemann classified diseases into 4 great divisions. Okay. Underline that. Hahnemann classified diseases into 4 great divisions. Next para. The first of these classification was simple. In that, embarrasses all diseases that might spring from mechanical and exterior sources. Okay, mechanical and exterior sources. Underline this. Underline first, all diseases from mechanical and exterior sources. This include fractures, strains, indiscrimination. Now, but fracture, strains, external poison, indiscrimination of diet छोड़ दो, that is indisposition, external poisons, fumes of noxious plants, extremes of thermic conditions. Okay, this is the mechanical cause, due to mechanical cause from external. Okay, now let me tell you that there was an injury. There was an injury on the hand and gangrene formed. There was a simple injury, a prick injury, and there was a gangrene form. Do you think this is a surgical disease?
No, sir.
Yes or no? Okay, why?
Sir, it's a simple injury that has मतलब disease का पैथोलॉजी के अनुसार ये प्रोग्रेस हुआ है, तो how can
There
this be a
is no
surgical?
proportion. There is no proportional relation between cause and effect. That prick injury should not cause a gangrene. Okay, that prick injury should not cause a gangrene. Okay. Next, you told that appendicitis is a surgical disease. Now, please explain and defend your answer. We have told that appendicitis is a surgical disease. Now, please defend your answer. How you can say that appendicitis is a surgical disease? Please, Rashmi, na? हाँ.
It is the inflammation, so it should be removed, no, sir.
It is inflammation, it should be removed. What if I tell I have cured so many appendicitis in my clinic? Is it true surgical disease? No, it is not true surgical disease until and unless it is causing a hindrance, hindrance to the cure. This is the product of disease. Cannot be a surgical disease, true surgical disease, until and unless it has been necrosed, until and unless it cannot reversed, pathology cannot reverse back. Now, so it is appendicitis is not a true surgical disease. Okay. Hydrocele. Who have told hydrocele? Anirban.
Aye, sir.
Now defend your answer. Why hydrocele is surgical disease?
Sir, hydrocele.
Why hydrocele is surgical disease?
वो जो sir, that fluid that is accumulated, it can cause a hindrance to our remedies. No, if we remove
Only,
that fluid,
only if it is causing a hindrance. Only if, not necessarily every hydrocele you should remove the fluid, every ascites you should remove the fluid, every pleural effusion you should, only if, clearly understand these things, that only if the symptoms at present, ascites may, if you are getting breathlessness, okay, due to ascites, clear? Prescribing for this breathlessness only will not
सर
cure your. हाँ बोलो.
सर एक बार रिपीट कीजिए ना, मेरा कॉल आ गया था, सॉरी.
Okay, I am repeating only. See, this ascites only if this is causing hindrance and the symptoms which are mechanical. I don't know why you cannot grasp this thing, that I have discussed it again and again. Out of repetition, out of danger of repetition, I am repeating it again. A patient having breathlessness due to ascitic fluid accumulated in peritoneal cavity, prescribing for this breathlessness will not do. Okay, until and unless the cause, which is, this is mechanical symptom. This is mechanical symptom. Just like Causavius law you have read in surgery about cancer of the head of pancreas. Cancer of the head of pancreas causing obstruction to bile duct and causing obstructive jaundice. Now prescribing for this obstructive jaundice will not help because this is mechanical symptom. Prescribing for that obstructive jaundice will not help because it is a mechanical symptom. Prescribing for this breathing distress due to ascites will not help because it is a mechanical symptom until and unless that symptom, that cause which is causing it is removed. Okay, this is mechanical symptom. Mechanical symptoms cannot be treated with homeopathic medicine. If it is being treated, it will come again because the cause which is keeping up disease is still persist. Okay, that is what the Dex principle is telling. Open this Stuart close. Open Stuart close. Scope of homeopathy. Scope of homeopathy. Page number 42. Page number 42. A sphere of similia may be defined as follows. Number one is, read, anyone read? Have you opened Stuart Close? Anyone having a Stuart Close with him?
Yes,
okay.
Sir.
Read number one. Read number one.
The scope of homeopathy is a subject which has received too little consideration.
No. Paragraph. Where you are reading? Page number 42. I must tell you the paragraph. Go. You will get a number after. See this. Number one.
Sir, chapter
Dex
name.
principle. Art. Chapter scope and limitation of homeopathy. Chapter number 4. Scope and limitation of the scope of homeopathy. Chapter number 4. You will get here. Following the exclusion method adopted by Deck. These are.
Sir, I got.
Okay.
So shall I read?
Hello. I think sorry for abrupt end. Those who are there, we can conclude for that Dex principle. I think my new headphone is not supporting by my phone. It was not supported by my phone. That is why this it's always getting disturbance with technical faults. Now the subject we were. Okay. I'm not audible.
Yeah, now you're audible.
Okay. The subject we were dealing with, the symptoms, mechanical symptoms cannot be treated with homeopathic medicine. You can treat for a while and then again that symptom will relapse. because the cause which is keeping up the disease still persists. The cause which is keeping up the symptom still persists. Okay. So this was the thing with surgical. Which disease to be called a surgical and which disease to be called, we have seen that gangrene due to a prick cannot be called a surgical disease. Okay. And those are other examples of surgical disease have been given in aphorism number 186. We will discuss it later on. So we went there from this tolle causum, and we have underlined this line: greatest number of diseases. In Heinemann's mind, there was that there are so many diseases which are falling under provenance of surgery. Actually, they are surgical diseases, but except those, we have given reference from Roberts that except those, all diseases are of dynamic nature. Greatest diseases means greatest number of diseases are of dynamic nature and should be treated with dynamic medicine. Okay, we will conclude here. Anyone having any question can ask, so that we will give it 5 more minutes to explain that.
Sir,
Follow.
sir,
I cannot hear you.
sir, can you? Sir,
Follow. I cannot
Sir.
hear you. हाँ बोल.
sir, can you hear me?
Yes, I can hear you.
Okay, sir, ये वाला the only
I cannot hear you again. I cannot hear you again. Sorry. I cannot hear you again. Okay, anyone ask me this question in group or in my personal WhatsApp number, I will explain. We have to conclude for today. Okay, I cannot hear you. Okay. Thank you all for giving me a patient hearing.